Good afternoon. Welcome to the daily briefing here at the St. Clair County EMA. We're joined by Chairman Mark Kern and also Sam Bierman from the Health Department. Sam, we have more numbers today, a lot of numbers.
We do.
Can you, before you give the numbers, kind of explain why we've tried this before, we're going to try it again, why these numbers are fluctuating?
Sure. So when you look at Illinois Department of Public Health's website for coronavirus and you're looking at the statistics for the number of positive cases, you will see there that it does say this information is provisional, which means that it can change, it can fluctuate, day to day. So the numbers are not going to be exact. We are aware of that. We want you to be aware as well. So when you see a difference in numbers that, you're not concerned as to why does St. Clair County have a different set of numbers from the state. So numbers like that are provisional, which means they can fluctuate, and it is expected that they do fluctuate. So I will go ahead and report on county totals, which are residents that have been tested that are from St. Clair County. As of today, we are at 1,011 patients that have been tested. We are at 228 positive test results, which is an increase of 27, and that does include males and females from the ages of 20 all the way up to the 90s. We are at 693 negative test results, with 90 results still pending. And I have some numbers that I hate to have to do because, we hate to report any deaths, but we have a significant, actually our most significant increase since we've started doing these briefings. We have an additional 4 deaths to report today. So that takes us up to 15. One is a male that was in his 80s that did have underlying health conditions. The second was a female in her 90s who also had underlying health conditions. The third was a male in his 80s that did have underlying health conditions, and the fourth was a male in his 70s with no known medical conditions. And these numbers never get easier to report in any category, but especially the deaths. I hate to have those numbers rise, and of course our thoughts and prayers go out to all of the family members that have lost loved ones to this virus. For state totals, we are at 116,929 that have been tested. We are at 24,593 that are positive, which is an increase of 1,346 since yesterday. And we are at 948 deaths, which is an increase of 80 deaths from yesterday for state totals. And I hate seeing that number. It guts me every time I look at it. Three new sets of numbers that we are going to be bringing to you. We have hospitalization numbers. So those are numbers that are currently in St. Clair County hospitals. Non-ICU patients, we have 37 that are currently admitted. ICU patients, 20 that are currently admitted. And patients that are admitted that are currently on ventilators are 12. And again, those are for hospitals that are in St. Clair County. So now I will turn it over to Chairman Kern for his update.
So the 4 new deaths today. This virus is impacting this community in a horrific way. We see there are 12 patients in St. Clair County who are currently on ventilators. Our prayers, our thoughts go out to every one of them. This tears at our guts to see this every day, and that's why we stress to you, probably until you're bored, to make sure you practice good hygiene, stay home. Let's isolate this virus so that we can get rid of this virus. We're at a point where the peak is starting to happen. You're starting to hear it throughout the country. We want that to be here so that we start to go down. But our days of returning to normalcy, I'm afraid, are some months away. We will get back to a normal, but it'll be a new normal. It'll be different times. I'm sure we'll still have to practice social distancing. When you go to the courthouse, you're certainly going to still see, or now you're going to see barriers between you and the person that you're talking to, just to make sure that everybody's protected. Until there's a vaccination for this virus, I'm afraid that we are going to see our world changed. And although we're going to get back to where we were. It's just going to take a little longer than what everybody thinks. But if we all stick together, we do all the right things, we're going to make it, and we won't have to be talking about COVID-19. And if we do it right, we won't be talking about COVID-20. So the zip code reports today. You're going to notice in two of the zip codes, our numbers actually went down, and that likely could have been because someone was released from a St. Clair County hospital, and then they decided to go stay elsewhere to be able to recover. So that number will no longer be reported in a zip code, or at least in the zip code that they were in when they went in the hospital, the address they gave to the hospital. So. As we said, these numbers come from the Illinois Department of Public Health. In 62201, 8 is the number, and that remains the same. 62203, 8 is a number, it remains the same. 62204, they remain constant at 7. 62206 is 18, that is an increase of 1. 62207 has 13, that is a decrease of 1. 62208 remains constant at 18. 62220 has 12. That's an increase of 1. 62221 have 23. That's an increase of 1. 62223, that zip code contains 19 COVID positive patients, and that's an increase of 1. 62226 has 32. 62258 has 10. That's an increase of 1. And 62269 has 19. That is a decrease of 1 from the last time we spoke, which was yesterday. Yesterday, we also became aware of a new wellness program that's being offered through HSHS St. Elizabeth's Hospital. It's outpatient therapy. It's something new. And today, Stacy Dixon is joining us. Stacy, welcome. Stacy's a physical therapist from HSHS St. Elizabeth's Hospital. How about let's just dig right in, Stacy, and tell us a little bit about this program.
Thank you. We wanted to anticipate the needs of the community during this time while they're sheltering at home, and so we have expanded our therapy services and are offering telehealth video visits. So this allows us to assess patients' needs while they're in their home remotely through a video portal on their computer, and we can utilize this for physical, occupational, as well as speech therapy.
So someone has never had to go to therapy before, but they find that they're shut in now. Mm-hmm. They've got to stay in place, and they're really not able to get exercise like they used to. You will coach them. Is that right?
Yes. So just like our traditional physical therapy or occupational speech therapy evaluations, we want to first listen to the person. We want to hear what their therapy concerns are. We will have them talk to us and let us know their underlying medical conditions. We will also look at their medical history, because all of those things can impact what we would specifically have them do. And then what we do then is a visual assessment, so we can have them walk, balance, move their arms and legs, whatever is safe for their specific condition. And then we've actually been doing these telehealth visits for the last couple weeks, and they're very effective in allowing us to demonstrate what we're asking the person to do. They are able to demonstrate the exercise so that we can give them feedback to see if they're doing it properly. And then we're utilizing an online exercise software so that we can email them their specific exercise program so they have that to refer to after the video visit.
So does a person have to have symptoms of COVID to be able to take advantage of this program?
No, not at all. One of the things that we want to make people aware of and that we're concerned about is that we know inactivity really affects the general health of especially our older population. So we need people to stay moving in their home and have specific exercises for their areas of weakness so that they remain independent and safe. When people are in bed recovering from something for as short as a week, or even just less active in general, they lose muscle strength. That affects their balance, that makes them at a higher risk for a fall. it maybe makes them unable to get safely up and down, in and out of bed, and moving around in their home. So it is important that we remember the general effects and benefits of exercise. That includes managing your blood sugar levels. It includes helping to manage the body's response to stress and anxiety, which we all have now. It also helps to improve our sleep and our mood and just our general wellness and health, so that if we do find ourselves sick, we have a better baseline to recover from. With our COVID patients, with patients that are recovering at home or have mild COVID, one of the things that we're very careful to assess and look at is their breathing. So COVID affects the respiratory system, and with that, we want to make sure that those muscles that are used with breathing are strong, but also they have the flexibility or the mobility and the posture, so that you can get a nice, effective, deep breath. When you do that, your breathing diaphragm descends, and so your ribs need to expand a little bit, your stomach needs to come out, and that allows improved oxygenation of the lungs. So we look at that. We look at visually how someone's breathing. We look at what muscles might be tight, and then we give them specific things at home to do so that they can improve their breath capacity.
So is there any special equipment that a person needs? Can they do this over their iPhone? Do they have to have an iPad or a laptop or something else?
We have them. They have to be able to access the My Chart portal that is through St. Elizabeth's. This allows us to keep their health information protected. So there are people using their iPhones. A lot of people are using their laptops, which allows them to have a bigger picture of what we're demonstrating for them. And so what people can do if they are wondering about this or if they have questions is they can call therapy directly. That number is 618-624-3668, and we will answer any questions you have. We do check insurance before we do this, and then explain everything you need to know to get a video visit set up.
But people don't necessarily need insurance if they're on Medicaid. Medicaid generally
Medicaid
covers
does
this.
cover this, yes. But we will check individual insurance plans before we would proceed.
And what about any equipment? So a lot of times you can lift weights with a can of beans.
Right.
Are those all suggestions that you give for?
Yes, we are very aware that some people do have exercise bands and things at home, so we, as part of our evaluation, will ask what you have access to, and then we're pretty resourceful at finding things in your home that you can use to do your exercises with.
Great. I think wellness is a huge deal during this time, just to be able to stave off COVID-19 if
Exactly.
that's possible. Herb Simmons?
Yes, Stacy, thanks for joining us today. How long has this program been going? It's fairly new, isn't it?
It is very new. We have been actually looking at the research and watching what's coming out from our other hospitals and areas that have been affected, and so we've put together this program in the last couple weeks, and we've been doing telehealth the last few weeks, and it's been very successful.
Are you finding any issues with the older population as far as the modern technology? And do you have anybody set up that maybe can help them walk through if they're not computer savvy?
Absolutely. We do speak with them on the phone ahead of time. We also send an email, and our IT has given us great shots of specific directions so you can look. And then we actually, for my first few patients, I was on the phone with them, helping them talk through what they were seeing and getting them set up.
Good. Thank you. Sounds like a great program, and I hope people will take advantage of it. Thank you very much for coming in.
Thank you very much. Thanks for your time.
Thank you. Yeah, we really appreciate you being here, Stacy. If you come back, and tell us how it's working.
Thank you so much. We really appreciate it. We also want to say we appreciate the community support. There's just been an outpouring of support for St. Elizabeth's, and through your support with the public health and emergency management.
Great. Well, that's very nice. Thank you, Stacy. So, we hear about wellness, and it's important for all of you to make sure that you stay well. Yesterday, Steve Johnson came on. Steve is the chief of police from the village of Swansea, and Steve talked about his officers and how they're on the front line and how they're dealing with COVID-19, even to the point where one of his officers does have COVID-19, and perhaps caught it from being on duty and from someone that they interacted with on duty. Those stresses are out there with the front line, and today Dana Rosenzweig from St. Clair County Mental Health is here to tell us about a new program that's going to benefit those first responders and their mental health. Dana, welcome.
Yes. Thank you, Mark. Yes, we're pleased to announce that after much planning and training, we're introducing today a COVID-19 support line for medical personnel and first responders, and that essentially is those people who are involved in the care of COVID individuals. Through the disaster mental health team that the Mental Health Board coordinates, we have an array of 20 trained professional mental health volunteers who have given their time and will provide intervention for medical personnel and first responders in need of additional support.
And so Dana, go through this for me, how they would access this and what that therapy really involves.
Okay, sure. What we've done is we've established a central line. So there's a number that I believe is being posted. It's area code 618-381-5173. All those calls will come to me. I'll screen them, and then I'll forward the information to one of our volunteers, who in turn will contact the individual and arrange for an appointment. The intervention itself, it's a blend, because this is such an unprecedented time in terms of disaster mental health response. We're more accustomed to dealing with a tornado or a flood or something that has a one-time impact. What we're seeing is that the unprecedented stress that the medical and first responders are having now is accumulating in a heavy toll for them. And many times they need to talk to someone outside of their home, outside of their workplace. Sometimes they don't want to speak to EAP. And so this is a place for a confidential discussion that's not therapy. It's an opportunity for them to deal with the stress and anxiety. And it's really a blend of, we have an individual, Russ Harris, who has a face COVID model that's really an acceptance and commitment therapy. And we've blended that along with psychological first aid, emotional support, trauma counseling, and referral support. And those are kind of the techniques that are blended that our volunteers will be using in working with the first responders and medical personnel.
And so this is an anonymous, this is really just a service that's being offered. There is no stigma. Everybody needs to use this. Everybody needs to realize their stresses. And you make a good point, being able to talk to someone outside of the home.
Right.
A lot of times people don't want your family to know that you're scared. I think everybody has a certain amount of fear during all this, and if you don't, you need to question why not.
Yeah.
These are fairly uncertain and scary times. So the types of questions that are asked, is the COVID-19 disaster, as we're seeing it, this pandemic, is it different than a flood disaster, a tornado, bad car accident, where people get those stresses that are our first responders?
Yeah, I think it is, because we have so much uncertainty we're dealing about, and the fear of the unknown can be very debilitating. And so that's a different factor that's playing into the pandemic now as well. And so we have to modify a response, that fits where people are at, and try to move them along to a place where they can function, where they can still cope and manage. These are going to be anxious times. People are going to have difficulty, and what this program is designed to do is just to assist them along and tie into some of their own resources, their own resilience, and help them be able to function, because these are personnel that have to go back into these environments every day, and that's what takes such a toll on people.
So Dana, this program will likely be around for a while. I assume that this isn't a thing that's going to be here 2 weeks, your program,
Yeah.
and then go away. You're prepared to take these calls for a lengthy period of time.
We are. We see our role as being one that's going to be probably as important in the recovery phase. I think that some of the services we're just now starting to identify. What are the trauma implications? What kind of things are people going to need? What specialized mental health services are we going to have to adapt and provide? And we're finding out that using the the telehealth, and in these instances, the majority of this service will be delivered using Zoom. And so we're thinking that we can even expand our ability to serve more people because we'll have some of these new tools available to us. So that's exciting in terms of being able to impact a greater population.
So this service is for the first responders. On the front line, we've got people who come from all walks of life. The program that's offered that would be helpful to them is the Touche
Yes.
hotline that you spoke of earlier?
We have a 24-hour hotline at Touche Regional Hospital, and that's 482-7158, and that is for the population in general, not specific to first responders and medical personnel, but just to citizens who are having some difficulty with these times and are in need of someone to talk with, a mental health professional. There are also a number of other resources that exist. This past week, the Illinois Department of Human Services published a Calm for Text line that we've put a link on our website, the stc708.org, which includes a 15-page PowerPoint, which is very helpful, and it has all of the information about contacting in the text line that the state's provided. So what we're seeing between the National Suicide Crisis Line, the SAMHSA Distress Line, we're seeing a lot more hotlines and resources being developed, and we just can't have enough, so that's good.
So give your website one more time so people can access that and maybe get more information.
That's www.stc708.org. And we update resources on a daily basis. Some of the difficulty now, there's so many resources, you have to go through them and decide which ones you're going to post, and but that's been a good thing.
You're a professional. I'm sure any ones that you're posting are tried and true, and you've tested out yourself, and we appreciate that. Herb Simmons.
Dana, just one question. You talk about this program being for the first responders. Mm-hmm. Is there any thought to where maybe their significant other one, maybe their family member? We've heard a lot about the stress that has on the spouse, that when their loved one's leaving to go out to work, whether it be the police, the fire, the EMS. We've heard some of those stories, and we get some of our questions on the followers page. Is that something that maybe you could think about?
Oh, certainly. I mean, it's our program. We can be flexible, and if there's a need that's not being addressed, we'd certainly want to do that. But at some point, we may need to expand our net of volunteers. I've talked to the Chestnut Health Systems. They're in the process of identifying some volunteers for us. So if we get to the point where the response is quite heavy, we want to be able to expand the volunteer pool and able to serve them.
And I bring that up because even some of the nurses that we've had on the show talked about how they've got a program that when they drive home, they park in the garage, and they've got their own little nook and cranny there to where they're changing, and they're isolating themselves from their family before they even go to meet them. That's got to wear on those family members. So that's just throw that out there for.
Yeah, I mean, we're asking people to disengage from the feelings that they're experiencing in the workplace, but much easier said than done, as you can imagine.
Exactly.
Yes.
We thank you very much. And,
my pleasure.
Welcome back here anytime.
Thank you for having me.
Thank you, Dana. Thanks for being here.
You're welcome.
EMA report, talk about that just for a few minutes. The 8 o'clock conference call this morning exchanged a lot of good information with the hospitals and the EMS providers. We had a conference call this afternoon with IDPH, trying to get some more answers out of them on these numbers that you heard us talking about. We sent out a survey today to our first responders, trying to think ahead, keeping our PPE equipment at least on order to where we can get it here as we continue to go through it. Real quickly before we close, you heard the numbers that Sam gave. Those numbers went up significantly today, and we expect that to happen. Not that we want that, we want it to stop. And what I want to say here today, I'm like Sam. When you talk about 4 deaths today, as we've said all along, one's too many. It's our job to track those numbers for you, and we're going to continue to report them to you. Your job is to help keep those numbers where they are, and you do that by staying at home and staying alive. Just think about that tonight. 4 more deaths that we lost here in the county. So be a part, stay home, and do your part about doing that. As you heard the chairman say, we're going to get through this, and we're going to get through it together. and it starts what we've been doing now for our 33rd day of trying to bring this to you. So these numbers don't lie. Just take a look at them and you'll see that it's real, it's here. We'll see you back here tomorrow afternoon around 3:30. Cindy and Daisy will be here momentarily to translate this into the Spanish communities. Thank you.